Okay, I'm just getting back to where we left off here in my PowerPoint. We're going to begin with fractures, I believe is where we left off. Oops. Sorry about that. So, we definitely got through calcium homeostasis. So let's talk about the classification of bone fractures. Bone fractures can be open, and some of you may have had some of these types of fractures before, or know someone that had these fractures before. Open fractures are those that protrude through the skin. A closed fracture would remain within the skin. A partial fracture is where there's splintering and not a clean break. And sorry, my antivirus is popping up there. A complete break would be where the bone is entirely broken in half or severed down the center. We'll take a look at some of those. A comminuted would be a shattered bone, where the bone is broken into many pieces. There are also some specific examples where, like a green stick fracture, for example. This is a partial break, usually just one piece bends. This is a common injury in children. Green sticks usually occur on the distal limbs, around the wrist, or around the ankle. An impacted fracture would be where one broken end is forced into the interior of another, so the bones are actually kind of colliding in an impacted fracture. Here you can see some examples. As I was mentioning, green stick, very common around the wrist. You have breakage in both bones. In this case, they're partially broken because of the bend in the bones. An open fracture, here protruding through the skin. A comminuted fracture, lots of crushed little pieces in that humerus. Here would be an impacted fracture, where you have this end of this bone digging into this other part of the humerus. Fractures can be repaired naturally through your body. In some cases, they might require surgery, depending on the degree of fracturing. And of course, some of you are familiar with the idea of splinting or casting to repair fractures. The broken bones are typically realigned into the position through the process of reduction. In other words, feeling the bones and placing them back in their normal position. Complete healing can take many months. It can interfere with blood supply. Because of the interference of blood supply, I should say, because our bones are highly vascular, there's lots of blood flowing through our bones, and if the bone is a complete break, the blood supply is affected to that bone, so the osteoblasts aren't able to get the nutrients they need to grow. An open reduction would require the surgical insertion of screws, pins, or even plates, whereas a closed reduction would just be manipulating the ends without any surgery. A fracture hematoma forms at the beginning of the healing process. Then a fibrocartilage callus forms. Then that fibrocartilage turns into a bony callus, and then bone remodeling reshapes the bone back into its proper form. So let's take a look at this. The fracture hematoma is the first thing that forms. The broken blood vessels, leaking blood, are going to clot. Some of the nearby bone cells are going to die in this case. Phagocytes, osteoclasts are going to help break down all of that dead stuff, all of the debris, clear out the area. Then about 3 weeks later, that fracture hematoma, by the way, can take several weeks to form, depending on the degree of the break. It takes about 3 weeks or so for the fibrocartilaginous callus to form, and this is where those special chondroblasts of the connective tissue are secreting those collagen fibers. Chondroblasts produce the fibrocartilage, all trying to piece the bone back together. The fibrocartilage callus is basically what bridges the two parts of the bone together, kind of forming a little band-aid there. Then the bony callus forms. This can take several months to form. Some of you that have had a broken bone may be able to feel where that bony callus was. It's literally like a little protrusion or a bump, so to speak, on your bone. And the areas close to that, the bone where it was broken, these osteogenic cells or osteoprogenitor cells differentiate into osteoblasts, producing that calcified matrix, and the fibrocartilage eventually becomes the spongy bone, which is going to be the bony callus that you feel. Then up to years later, this can take the process of bone remodeling, where the osteoclasts reabsorb the dead fragments, The compact bone replaces the spongy bone, and eventually the osteoclast and osteoblast activity balance out, and you get almost a complete reformation of the original bone. In some cases, it will never be the same, all depending on how it was broken and the types of blood vessels that were injured in the process. The next section of this chapter goes through the parts of the skeleton, which I will lecture on. However, you're going to hear them in lab. You will be tested on these just like you would be tested on all of the physiology, so all of these are fair game for the lecture portion of this class as well. But you'll have your lab practical on these bones more specifically. Your lab instructor will give you a specific list of the bones that you need to know. So, the axial skeleton is composed of the skull, the vertebral column, and the thorax, or rib cage. There's 80 bones total that make up the axial skeleton. The skull itself is made of 22 bones. 8 of those bones are the cranial bones that protect the brain. They also form attachment points for the meninges, the special coverings around our brain and spinal cord. And they form attachment points for the muscles that move our head. There's 14 facial bones. Our facial bones contain special openings for airways and the digestive system. They also protect our sensory organs like our eyes and nose. They provide attachment points for our facial muscles as well. So looking at the axial skeleton versus the appendicular skeleton in this picture, it comes straight from your book. When we're talking about the axial skeleton, we're not talking about the shoulder blades. We're talking about the head. We're talking about the vertebral column. We're not talking about the hips. We're talking about the ribs and the sternum. When we talk about the appendicular skeleton, this is where we're talking about your collarbone, your clavicle, your scapula, your arms, your legs, your hips. So let's begin with the cranial bones. You have this nice color-coded picture here. The frontal bone is this blue bone right on the front and the frontal region of your skull. The parietal bones on the sides. On the back in the occipital region is your occipital bone, and then your temporal bone is near your temples. The temporal bone forms the temporomandibular joint. It also has the hole for your ear, your external auditory meatus. It has a process called a mastoid process, which is this big lump right here. There's also a foramen called the carotid foramen, which you can't see from this angle. It's underneath. And there's a styloid process, which kind of looks like a vampire tooth. Think of a styloid pen. It's a type of pen with a very pointy tip. There you see the styloid process with its very pointy tip. Also on this diagram, just to point them out to you, are some other bones. This green bone here is called the sphenoid bone. Kind of an odd name, but it plays a very important role in some structures, as we'll see later. You also have your zygomatic bone, which helps to form your cheekbone. You have the maxilla bone, which goes up around your eye as well as holds your teeth, your upper row of teeth. You also have nasal bones on either side of your nose. The mandible is your jawbone, which also has teeth in it as well. So let's talk about some features of your occipital bone. You can see your occipital bone here in orange. The large hole at the base of the skull is the foramen magnum. The occipital condyles on either side of the foramen magnum form points of attachment for your vertebral column. This allows for that yes motion, that nodding of the head up and down. You can still see that odd-shaped green bone that I pointed out before. This is your sphenoid bone. Your sphenoid bone has sinuses within it. Sinuses are kind of hollow openings that may contain fluid, or they may just be air chambers for your body. The sella turcica you can't see from this inferior angle, but you can kind of see, where'd my mouse go? Kind of see from this interior angle. The sella turcica is this inner bumpy area of the sphenoid. This whole green bone is the sphenoid. Here you get a good shot of those hollow areas called the sphenoid sinuses. The sella turcica is this inner area here. Within this sphenoid bone is the optic canal, optic foramen, it's also sometimes known as. That's where your optic nerve passes through. There's also a foramen called the foramen ovale. You can't see it well from this angle. You can see it better from the interior view of the skull. The ethmoid bone is not very easily viewed from this diagram. It's another little inner nose bone, kind of in this general area. You can get a little smidgen of it right here on this diagram. The ethmoid bone contains sinuses as well. It has a concha related to it, and you can see those on the nose right here, this little pink guy. You'll see, I'll point them out on another diagram. There's also the crista galli and cribriform plate, both of which you can't see from these diagrams. I'll point them out later. From this frontal view of the skull, let's start with the nasal bones. You have two nasal bones right here that forms the bridge of your nose, so to speak. The rest of your nose is formed from cartilage. The maxilla is that upper jawbone, that has our upper teeth attachment. It goes up the sides of our nose and around our eye sockets. The maxilla has a maxillary sinus associated with it, as well as the alveolar process. The alveolar process helps with the attachments of our teeth. There's also palatine bones and maxilla, which create the hard palate, which is the roof of your mouth. So if you stick your tongue up to the roof of your mouth, what you're feeling towards the front of your mouth is the maxilla, and then if you stick your tongue towards the back, that's the palatine bone that forms the back of your hard palate. The mandible is your lower jawbone. There's a condylar process that you would see on this bone. It's up towards the back. That's going to be what articulates with the temporal bone back at your jaw. If you move your jaw and stick your finger back where that jaw movement is, you can feel that condylar process articulate with your temporal bone. There's also a small hole called a mental foramen on the mandible. This allows for innervation and blood vessels to get into your teeth. The zygomatic bones form your cheekbones as well as part of your eye socket. Lacrimal bones are these little teeny tiny bones that are in the inside corners of your eye. From this view, you can see parts of the ethmoid bone. You can see, where'd my mouse go? Here it is. This little orange piece here is ethmoid bone on the inside of the back of the eye socket. You can also see those concha that I mentioned before. These little kind of curly Q-like structures inside of the skull are called concha. They form the inferior and middle nasal concha. This would be the inferior concha. This would be the middle concha. This piece right here is also part of the ethmoid bone. It's called the perpendicular plate of the ethmoid bone. That meets up with another bone that stems off of the maxilla. It's called the vomer. The vomer and the ethmoid bone perpendicular plate form that nasal septum, that dividing line between the two nasal cavities. If we look at the top of the skull, you'll see that there are suture marks. The skull itself is not made of just one solid bone. These bones, of course, fuse together after the child has been born, after delivery, and the whole purpose that there's several different bones is so that that head can squeeze through that nice tiny opening. There's a couple sutures that you should be familiar with. The coronal suture, sitting like a crown on the top of the head, separating the frontal and parietal bones. There's a sagittal suture, making a nice mid-sagittal section down, separating the head from right and left. There is what's called the lambdoid suture back here, dividing the parietal and occipital bones. And the squamous suture is the suture that divides the temporal bone and the parietal bones. You can't see it from this view. The paranasal sinuses you cannot see from this view either. The fontanelles are the special soft spots. Normally there would be a fontanelle here and a fontanelle here. Those of you that have ever held a newborn know not to touch the top of their head. That's because there's literally gaps where those sutures eventually come together. The hyoid bone is another important bone related to the skull, except it's technically a bone of the neck. It is its own little free-floating bone. We'll look at that on a future diagram. Let's talk about the spine and vertebral column. There are 26 bones, or 26 vertebrae. Their functions include to protect the spinal cord, to support the head and neck, allow for movement, as also to allow for attachment points for our back muscles, our ribs, and our pelvis. There are 4 curved regions to an adult spine. There's the cervical curve, the thoracic curve, the lumbar curve, the sacral curve. One of them goes out, one of them goes in, the next one goes out, the next one goes in. our spine is not perfectly straight. It's not meant to be straight. It's curved to help absorb all of the shock that's coming up from the lower limb movements. Abnormal curvatures include scoliosis, which would be a lateral curvature. It's more common in females. Kyphosis, which would be that exaggerated thoracic curve leading to that humpback appearance. And lordosis would be an exaggerated lumbar curve causing that sway back. This would be what pregnant women have when they have very, very large bellies. Their back is very, very swayed in the lumbar region. That's the lordosis. We look at the anatomy of a vertebrae. First of all, notice that not all vertebrae are created equal. At the top, just inferior to the head, you have your cervical vertebrae, and there's 7 of those. Then you have thoracic vertebrae. Thoracic vertebrae are different from the other vertebrae because they have attachments for the rib cage. They enclose the thoracic cavity. Then you have the lumbar vertebrae in the lumbar region of the body, and then finally the sacrum, which are made of fused vertebrae, and the coccyx, which is also made of fused vertebrae. Each vertebrae has a spinous process, 2 transverse processes, a superior and inferior articular process. They also have pedicles and lamina and a vertebral foramen. Let's look at some of the differences here. Our cervical vertebrae, as I mentioned, are within the neck area. There's 3 openings or 3 foramina. The opening for the spinal cord, that is called the vertebral foramen. Then you have 2 transverse passages. These are for the blood vessels. You can see here the superior articular process because this is the top of the vertebrae. And then on the bottom, if we were to flip this guy over, you would see the inferior articular process. The vertebral body is relatively small on the cervical vertebrae. You have transverse process on either side of the body, and then a spinous process which sticks out posterior. On a thoracic vertebrae, again, looks very different from a cervical vertebrae. This is another superior view, so you see that superior articular facet here, and if we were to turn this guy upside down, you would see the inferior articular facet. You can see the 2 transverse processes, in this case, look very different from the transverse processes of our cervical vertebrae. The spinous process, always sticking out posterior. Vertebral body is a little thicker. The vertebral foramen is a little smaller because at this point the spinal cord has gotten thinner as some spinal nerves have begun to offshoot. You can also see the pedicle a little better. The pedicle attaches the vertebral body to the transverse process. So the pedicle is just this little arm right here on either side of the body. You also have the lumbar. The lumbar, again, are very distinguishable from thoracic and cervical. They have a very large vertebral body, a relatively small vertebral foramen. Pedicles are a little bit more exaggerated. Transverse process is larger. These transverse processes are for muscle attachments, and that spinous process, again, sticking out towards the back. You also have that superior articular facet or articular process and an inferior articular process as well. The sacrum and coccyx help join with our coxal bones to form our hips. You can see it's made of fused vertebrae. You can see where the spinous process once was of these vertebrae. This is the posterior view. There's sacral foramina within there for blood vessels to pass. And the coccyx is roughly 4 vertebrae fused together. This makes up our tailbone. Some people have more, some people have less. Some people are actually born with a small bump for a tail. It's not, you don't have any muscular control over it, so it's not like you could wag that tail or use your tail for anything. It's a vestigial characteristic. Let's talk about the bones of our thorax. There's 12 pairs of ribs, which correspond to the 12 thoracic vertebrae. You have 7 pairs of true ribs. True ribs attached directly to the sternum. You have false ribs, which are ribs that do not connect directly to the sternum. And then you have floating ribs, which are ribs 11 and 12, the last 2. This is a typo here. This should be false ribs 8 through 12, not 3 through 12. So just make note of that. The sternum is your breastbone or your breastplate. It's actually made of 3 bones that are fused together. The manubrium is the top part or superior bone. This is what articulates with the clavicle and the first rib. So if you feel on your neck, you can feel that little notch at the top of your sternum. What you're feeling there is called the jugular notch. That's the very tip top of the manubrium. The body is the very hard center part of the sternum, and then the xiphoid process, which is made of cartilage that slowly ossifies, is a little pointy part on the distal end or inferior edge of the sternum. It does not make any articulations with the ribs. Here you can see what I mean when I was talking about our true ribs all connecting directly to the sternum at about rib 8. Rib 8 connects with 7 and then connects to the sternum. Ribs 11 and 12 don't connect to the sternum at all. So those are our floating ribs. 8, 9, 10, 11, and 12 are false ribs because they do not connect directly to the sternum. And then ribs 11 and 12 are further classified as floating because they don't attach at all. If we were to look closer at our sternum here, you see that kind of stop sign shaped manubrium, the body, and then the xiphoid process, which is mostly cartilage that slowly ossifies. You can see this manubrium articulating with the clavicle as well as rib number 1. This is an anterior and posterior view of our bony thorax, and you can see some of the other bones that we're going to get into on our appendicular skeleton, the clavicle, as well as our scapula, our shoulder blade. You get a much better view of the scapula on the back side. And then you have, of course, our humerus and scapula all creating that shoulder joint. So let's talk about the thorax bone functions. Ultimately, the bones of our thorax are there to protect our heart, protect our lungs, provide points of muscle attachment, mostly for respiration, a little bit for arm movement, our pectoralis muscles, but for the most part, the muscles around our ribs are all dealing with allowing our rib cage to expand for inhalation and exhalation. Let's get to our appendicular skeleton. Here we have a pectoral girdle and a pelvic girdle, the arm, the hand, the leg, and the foot. So our pectoral girdle attaches the upper limbs to our axial skeleton. It's made of your clavicle and scapula. The clavicle, as we saw, connects with the manubrium of the sternum. The scapula has a couple points of attachment. The coracoid process on our scapula is an attachment for muscles, and then the glenoid cavity is where the head of the humerus attaches in order for formation of the shoulder joint. So here you can see the coracoid process and the head of our humerus coming into that glenoid cavity. Going into our arm and hand, our upper arm is made of our humerus. Proximally articulates with the glenoid cavity, distally with the radius and ulna. Our ulna and radius make up our forearm. The ulna is on our pinky side if we're thinking about anatomical position. It's medial to the radius. It attaches at the trochlear notch right here on the humerus. And the olecranon process is going to help form the point of attachment for our elbow joint. So our ulna has a little U-shaped process called the trochlear notch, which goes around this trochlea on the humerus. The radius is on the thumb side of our forearm, and this allows for that 180-degree rotation, or that pronation and supination action of our forearms. We get into our hands and wrists. The carpals are the wrist bones. You drive a car with your carpals, right? It's a set of 8 bones arranged in 2 rows. And then you get to your metacarpals, which are your knuckles. There's 5 bones here. Most of our fingers have, or all of our fingers have a metacarpal associated with it. And then the phalanges are fingers. There's 2 bones in each finger and 3, that is not right. That's the opposite. It should say 2 bones in the thumb and 3 bones in each finger. Your thumb only has a proximal and distal phalange. All of your other fingers have a proximal, middle, and distal. So this is reversed. There's 2 bones for your thumb and 3 bones for each finger. Sorry about that typo. There you can see your specific carpals, your specific metacarpals. It's up to your lab instructor if you need to know all of those carpals and metacarpals. But you can see what I was mentioning with the phalanges. There are 3 phalanges for every finger, except for the thumb. There's only 2. Moving down to our lower limbs, we have our pelvic girdle, which is composed of the 2 coxal bones, or 2 hip bones, the sacrum, as well as the coccyx. Each coxal bone is made up of 3 bones that actually fuse together. Those 3 bones are the ilium, the ischium, and the pubis. The acetabulum is where all 3 of those bones meet. That's the little indentation, or I should say large indentation, for your femoral head. The pubic symphysis is the articulation of the coxal bones on the anterior side. This is right at the pubic area of your body. You can see what I mean with the coxal bones here, forming that articulation with the head of the femur. You can see that very deep acetabulum. The 3 bones are differentiated here. The ilium is this nice big crest. The ischium is the butt bone, so to speak. And the pubis is this anterior bone here, which joins with the other pubis to form the pubic symphysis. These 2 coxal bones, the ilium of either coxal bone, meet up with our sacrum and coccyx to form the complete pelvis. So our pelvis, as I mentioned, is formed by those coxal bones, the sacrum, and the coccyx itself. The pelvic brim is separating the false pelvis from the true pelvis. So the false pelvis is actually part of your abdomen. This is where the urinary bladder and uterus would be. That's what we tend to think of as our pelvic region. The true pelvis is actually surrounds the pelvic cavity. This is where large blood vessels get to through our legs. This is kind of the deeper areas that you wouldn't necessarily be able to feel from the exterior. Some differences in gender. You can just compare these 2 pictures here. One's a male, one's a female. Female pelvis here, much wider. If you just look at these iliac crests, much greater false pelvis in a female as opposed to the male. Check out this pelvic brim, or the pubic inlet or pelvic inlet, much narrower in males than in females, which is much wider. You can't see the coccyx in this case, but the coccyx in a female is not quite as curved. The male's coccyx curves very much anteriorly, so that if you were to tip this up and actually look inside of it, the male pubic inlet would actually look like a heart, as opposed to the females, which is more oval shaped. You can check out the pubic arch here on the females, much wider, and it's much more narrow on the male. If we were to look at the leg more closely, there's 3 major bones of our leg. If you just glance at this quickly, it almost looks like an arm. It's made of the same formula: 1 bone, 2 bones, and then lots of little bones. That one big bone that attaches to the axial skeleton is our femur. That's our thigh bone. It articulates with the acetabulum on the coxal bone, and then articulates distally with the tibia. It should not say acetabulum there. I'm just now proofreading this. This is the PowerPoint that came with the textbook, and that's a typo. It does not articulate with an acetabulum distally. The tibia is your medial shin bone. This is where most of your weight is bearing. If you just look at this leg and how it sits here, the femur sits directly on top of that tibia. The fibula is off to the side, providing lateral support. So that femur, or that tibia rather, articulates with our femur proximally, distally with a special bone called the talus, and it articulates with the fibula on its lateral side. The fibula is the lateral shin bone. Notice the names of these. It's tibia and fibula. It's not a tibula, it's not a fibia. So please note the difference in those 2 words. The fibula is the lateral shin bone, fibula lateral, that articulates with the tibia proximally and as well as distally. So it kind of inserts on both ends of the tibia. It also articulates with the talus at the ankle. Look closer at our ankle here. You can see the distal end of our fibula and distal ends of our tibia articulating with a special bone on our foot called the talus. There are 7 bones that make up our ankle. The calcaneus is the large bone that makes up our heel, and you can imagine the calcaneal or Achilles tendon coming up and off of this. You can feel that if you touch the back of your ankle. If you touch the sides of your ankle, the medial part of your ankle, that inner ankle, is actually your fibula, and I'm sorry, I had that mixed up. The lateral side is your fibula, the medial side or inner side is your tibia. So when you touch your ankle, you're actually touching two different bones, one on the inside and one on the outside. You have metatarsals as well. Those metatarsals are analogous to the metacarpals of the hand, so you have one for every toe, and then your toes are set up in the same order with the phalanges. You have 3 phalanges for every toe except for your big toe. That ends part 2.